Hello and welcome to Dialogue. The head of the World Health Organization has confirmed that the Delta variant of the coronavirus has been found in at least 98 countries and regions. And it is spreading quickly in countries with both low and high vaccination rates. So how dangerous is the new variant, and how well do current vaccines protect us? And how will we cope with the COVID-19 as it continues to mutate? To find out more, I'm joined by Dr. Megan Rani, an emergency physician at Lifespan Brown University, Dr. Mohammed Munir, a virologist and lecturer in biomedicine, health and medicine at Lancaster University, and Benoit Hadi Chatrand, adjunct professor at political science and international affairs at Temple University from Japan. That's our topic. I'm Zhou Yue. Let me start with you, Megan. What is actually the Delta variant of the coronavirus, and how dangerous is it compared with the other variants we've seen before?
So the Delta variant is just the very newest of the variants. It's the one that was first identified in India and was responsible for that huge surge of cases there. It seems to be about 60% more transmissible than the Alpha variant, which was the one that was responsible for the big surge in England and in the United States over the winter. It's still not clear whether or not it makes people sicker, whether it leads to a higher number of hospitalizations, but that transmissibility alone is scary because it just means that it spreads faster and will get more people sick.
So it is more transmissible, but the WHO warned the Delta is probably the fittest coronavirus strain yet. Will it lead to overwhelming of hospital capacities and more hospitalization in the end?
So certainly among unvaccinated populations, it will lead to overwhelmed hospital populations. You just have to look again at what happened in India in the spring to see what's ahead for many countries across the world. Now, in countries where there are high rates of vaccination, we will certainly see surges of COVID-19 with this Delta variant. We're seeing it in some states in the United States right now. Missouri, Arkansas, and others are seeing dramatic rises in the numbers of hospitalized cases. But for most countries with good rates of vaccination, we're unlikely to see the types of surges that we had in 2020 and early 2021.
Mohammed, what about the UK? I know the vaccination rate in the United Kingdom is pretty high. Does it prevent Delta variant from getting hold of people?
Yes, absolutely right. In the UK, we have a quite high vaccination rate. Around 85% of the population, eligible population, have first dose, and over 60% of the people are having double doses, which is really high coverage. When we look onto the overall impact of the vaccine onto the Delta variant, because Delta variant now represents around 95% of cases in the UK, we can see that certainly the link between the number of cases and hospitalization versus death has completely weakened. I mean, if it is not broken, it's a significant reduction in hospitalization and deaths. But having said that, the overall efficacy of the vaccine has been relatively lower against Delta variant compared to the Alpha variant, around 88% with the Pfizer vaccine with 2 doses, and around 66% of AstraZeneca with both doses. That is the efficacy. So certainly it is around 20 to 30% lower vaccine efficacy compared to the Alpha and other variants that have been circulating before.
So are you saying that the vaccines still provide satisfactory protection against this new variant, Mohammed?
Yeah, yes, absolutely. So far, I think the most powerful tool that we have had about new variant is the vaccine. But that is with a big caveat, and the caveat is that you have to have 2 doses of the vaccine. For instance, AstraZeneca provide only 30% of protection against Delta variant if somebody is only having a single dose. But that 33% shoot to 80% when both doses are administered. So the real importance here is that somebody is fully vaccinated with the right combination of the vaccines or the vaccine that is recommended, they provide enough protection to at least minimize, if not completely block, the hospitalization and deaths.
And do the British understand that they need to get a full vaccination to have enough protection?
I think that is our real challenge, because we quickly ramp up to 60% to 65% of the total population. But beyond that is really a big challenge. The challenge is because there is a certain level of vaccine hesitancy, and then we don't have a recommendation for the vaccine in children. So which means that reaching to the 70% of the herd immunity is relatively tricky, and particularly at the time when we are opening up almost fully and completely.
And earlier, Megan said that we don't know whether those got infected with the Delta variant got sicker or not. Do you also know that there is no enough data to support whether it is more virulent or not?
Yes, completely agree with Megan. We do know now that this Delta variant is a lot more transmissible within the community, because it has a mutation within the spike protein onto the surface of the virus. Those are making this virus bind very strongly to our cells and therefore internalize. And also we have indication that relatively smaller quantity of the virus is required to establish an infection, and also a smaller quantity is required to transmit from one person to another person. So overall transmissibility is proven to be higher compared to other variants, but whether that is making people much more sicker or not, one data that is pretty clear is that the Delta variant is more infectious in unvaccinated people, which is very obvious. And unvaccinated people, if they are infected, they are likely to end up in hospital, probably not because of the Delta variant itself, but just because they are not vaccinated, therefore they don't have protection against.
Megan, what is more worrying is that Delta itself is evolving as well. And health authorities reported in June that a subvariant with additional mutations, they say, Data Plus, has already caused 50 infections in India. And some people say that already changed the behaviors of the spike proteins a little bit. We don't have enough data to consolidate that. But how worried are you about the evolution of the coronavirus?
So right now, neither the Delta nor the Delta Plus strike fear in my heart. I don't like them. I wish they weren't out there. But as Mohammed said, the vaccines still have tremendous efficacy. What worries me more is the variants yet to come. We know that viruses mutate. As long as most of the globe is not vaccinated, there will continue to be new variants, and one of these days, there's going to be a variant that escapes the vaccines, against which the vaccines do not protect. That's the moment that scares me, because then we're back to square one. So we have a tremendous pressure on behalf of the entire world to get people vaccinated as soon as possible to try to avoid that moment coming.
But you understand that the vaccination rollout is going on differently in different countries and even in different regions in a single country. So apart from that, what else can government and the public do to prevent that virus from mutating too fast, too quick?
So there's two things. First is that we can increase vaccine drives. There are a number of international efforts that have been underfunded and have not been given proper support, either of vaccine donations or of money to help support countries in distributing vaccines. So there's absolutely more that we can do on the global vaccination effort. But the second thing is that masks and social distancing still work. They are still tremendously effective against every variant, and there's no reason to think that they won't work for variants to come. So for folks that are not fully vaccinated yet, continuing to mask when out in public, trying to be outdoors whenever possible, and maintaining physical distance between themselves and other unvaccinated people are still very effective measures against COVID.
But obviously, people think differently in different places. Mohammed, your Prime Minister Boris Johnson just announced on Monday that most of Britain's COVID restrictions will be lifted on July the 19th. Considering the context is that Delta is still being found on a daily basis in the UK.
Yes, absolutely. It's a very risky narrative, particularly at the stage when we are having quite high number of daily cases. We are having a little more than 25,000 cases per day, which is more than, actually 5 times more than the cases we are seeing in EU member state combined. So we do understand there is a link between the infections, hospitalization, and unfortunate deaths. That is relatively weakened. But what we don't really realize here is that the link between the cases and the long COVID, pardon me, the link between the new cases and the long COVID is not yet weakened, and no data is in there. Here in the UK, we have around 1 million people living with COVID, long COVID, because of these infections. So even if these not end up in hospitalization or death, still it would have a lingering effect onto the overall health status within the population. And I think more to do so is that all the restrictions that are been working very well, including the social distancing and the mask, those been all scrapped all at once, which is certainly one of the fertile area for the viruses to mutate.
Based on what Boris Johnson made that decision, and doesn't he understand the consequences of lifting all the restrictions?
I think in the government, everybody understands the consequences it would bring, because according to the government own statistics, if the number of cases that we are having now, if it follow the same trajectory, by the end of this month, we will have around 100,000 cases per day, which is a lot more than what you can imagine from a single country, the country which has more than 60% population vaccinated. But I think one thing that is driving them is that their narrative is that as long as the national healthcare sector can cope with the hospitalization, the government is okay to move on, which is certainly very risky.
So this is Boris Johnson's version of living with COVID.
Absolutely. Although in the scientific community, we don't really see that living with virus is possible, particularly at the situation where we are, because basically what we are having 60% of the UK population vaccinated, we are using them as a lifeboat. But all what we need to do is to support the lifeboat, but not to overburden them by mass vaccination, by rolling out vaccination to children, to really remove the possibilities of transmission. Because if we overburden the lifeboat, we are going to sink altogether.
And Megan, in the U.S., Anthony Fauci has predicted that the U.S. will also see surges in cases of the highly infectious Delta variant. You mentioned in Kansas and other states where the vaccination rates are very low. So how would you assess the current COVID situation now? Because obviously Biden has done a lot to vaccinate a lot of Americans, but not enough, right?
Oh, we are in a very good situation in some states. My home state of Rhode Island, more than 76% of adults have gotten their first dose of one of the COVID vaccines. But there are other states where 20 or 30% of people are vaccinated. So we're going to be facing a situation where those states with really low vaccination rates do face
Why
huge
so
surges
low
in
vaccination
COVID,
rate in some
in these
states?
summer months when people are inside. Great question. There's a variety of reasons. So the states with low vaccination rates are also states that in general have a lot of other poor health outcomes. There are states that have higher rates of opioid overdose and suicide and obesity and high blood pressure. There are states whose health policies in general don't support a healthy population. There are also states that by and large voted Republican in the last presidential election, that may be hearing more misinformation or lies from the popular media and from social media, and where there's a lot of mistrust of the vaccine and of the U.S. government.
So under the Biden administration, vaccination is still a very politicized issue in the U.S.
It unfortunately is. You know, this virus attacks everyone equally, regardless of whether they're a Republican or a Democrat. But there is a narrative on the side of the far right that is being propagated by bots and by bad actors that makes people think that the virus is not real or that the vaccines are somehow harmful. We're doing a lot of work in the scientific community to try to combat that. There's also a portion of the population that just don't know enough yet about the vaccine who we're trying to reach as well. Many of us have said that right now in the United States, we're in the ground game phase of vaccination. You know, it's now trying to reach the hard to reach populations, which takes more work to get every shot in arm. But we have not given up, and we are still giving out a lot of vaccines every day. And luckily, as Mohammed alluded to, we do have the vaccines approved for age 12 to 17 here, which is helping us in those vaccination efforts.
But Biden made the promise to vaccinate 70%. Is that 70% of Americans before July the 14th? So how can federal government help in any way, especially in those states where vaccination rate is still remarkably low?
So the Biden administration continues to provide support to states where the vaccination rates are low, both by distributing vaccine, by making federal workers available, and by supporting the structures, by providing blueprints for how to do this, with community health centers, with primary care doctors, with setting up vaccine fairs or larger health fairs where vaccines can be just gotten while you're out and about and doing other things. It is a day-to-day push on the part of the Biden administration to try to help those states to increase their vaccination efforts. The one last thing that I'll say is that as we are seeing surges in some of these states with particularly low vaccination efforts or vaccination rates, I expect that we'll see an uptake in vaccines. We know from the history of vaccines, the history of public health across the world, that people are more likely to get vaccinated when they're scared of a disease. And so sadly, it may take another surge to convince people to show up and get their vaccine to protect themselves.
Well, that seems to be a very sad fact. But Mohammed, is it the same case in the UK? It will take another surge to convince British to go forward with the vaccination rate, considering many of them still have one single shot, and many of them haven't even a single shot.
Yeah, I think overall vaccination uptake in the UK has been pretty good, and it has improved instead of deproving over the course of the vaccine administration. As Megan been alluding, I think the important thing is that we educate, we highlight the importance of the vaccine, because these vaccines are our ultimate weapons against these emerging variants. But it comes with a big question that how quickly we can roll out, not only within a country, but also across the globe before these variants would emerge. And our vaccine rollout has to be much faster and quicker than the variants are emerging. In the UK, I don't think that there would be a big issue in moving into the level where we want it to be to establish the herd immunity. But there are pockets in London and minorities, black ethnic minority, where there is a high level of hesitancy. But I think the major issue at the moment that what we are seeing is with the people who are reluctant to take the second dose. And all what we need to do is to make sure that they take the second dose, because the protection that you will get with the double doses is much more than what you get with a single dose.
You mentioned the final threshold, maybe for everybody, is whether we can have that barrier, the immunity barrier. Megan, some experts have suggested that a 70% COVID-19 vaccination rate could lead to herd immunity, but others saying that herd immunity might not be possible, considering there are many complicating factors, including unclear about the vaccine efficacy, the different rollout rates, new variants, challenges, and the length of immunity that can stay there. What do you make of the possibility of establishing herd immunity anywhere in this world?
So I think herd immunity depends on a few things. The first is, yes, how well these vaccines work against the variants, how well the vaccines prevent you not just from getting really sick, but also prevent you from passing on the virus should you be unlucky enough to have a breakthrough infection. And then the third thing is, what percentage of the population was already infected with COVID-19, and how effective that natural immunity is at protecting you against novel variants. So the number that we need to reach herd immunity is going to move across countries and over time as there are new variants. The thing that I and a bunch of other public health experts are focusing on is not a specific number for herd immunity, but rather just getting as many people vaccinated with effective vaccines as we can. The more folks that are fully vaccinated, the better off we're going to be, period. And if it's 50%, that's better than 40%. If it's 80%, that's better than 70%. But every vaccine that we put in an arm is really a win for public health and for the community.
But recently we have been hearing news of lockdowns of cities everywhere in the world. Recently, a city in southern China, Ruili, bordering Myanmar, announced a level 3 emergency response to partial lockdown in that city. That happened after Guangzhou and Shenzhen was partially locked down, also because of imported Delta variant infections. So do you think international travel will still be very hard, considering that there's no global herd immunity anytime soon?
I think we're going to continue to see rolling lockdowns, imposition of quarantine requirements, imposition of masking requirements as variants spread across the globe. I think every country, as we're seeing already, is, for better or worse, going to treat this in their own way. I mean, the EU has just lifted quarantine requirements for some countries and put them in place for others. It's going to continue to change. I think COVID is going to be with us for a very long time to come. And again, my biggest hope is that we can roll out vaccines quickly enough to prevent those really lethal and vaccine evading variants from developing. Delta variant is scary, but it's not the worst one that could happen. And so for now, I think that we will see some difficulties in travel, but it's not going to be completely stopped. And again, each country is going to respond to this in its own way, just as we're seeing differences between the UK response, the US, and China.
We have Benoit joining us on the line. Benoit, of course, different countries responded differently, but Japan is special because it's about to host the Olympics this summer. And it's still facing thousands of new confirmed cases every day. So what public health measures do Japanese take to protect the public and the athletes?
Well, there have been several measures that have been taken since the beginning of the pandemic. More recently, Tokyo, as well as 9 other prefectures, were under a state of emergency. Now, the state of emergency was recently lifted, but we are still living under a quasi-state of emergency. Now, with regards to the Olympics themselves, there are several strict measures that have been taken. First, it was limited to 10,000 spectators in the venue, but just a few days ago, they have announced that it would be capped at 5,000 per venue. And they've even left the door open to possibly banning all spectators to all events. So it may go even further than it already is. They've also released some guidelines for the fans in case there are fans in the stands. For example, no screaming, no high fives, only clapping, no alcohol allowed in the venue. So it's going to be certainly a different kind of atmosphere than what we are used to during the Olympics. Yeah. Another important measure I want to mention is the fact that the athletes are strictly prevented from leaving the bubble. So that's going to be also pretty difficult for a lot of the athletes, especially those whose events are at the beginning, who usually want to go out and, wander and visit the city. They're not going to be able to do that now. There are many events surrounding the Olympics as well that have been already canceled. Parts of the torch relay has been canceled. So yes, many measures have been taken, but of course we have 11,000 athletes in the city, so the risks obviously remain.
Because COVID made everything different. Olympics is supposed to be fun, but what you just said make it less fun. A lot tense in there. A recent poll in Asahi Shimbun showed that 83% of Japanese want to cancel or postpone the games again. They're not in the mood of celebrating Olympics this summer.
No, they certainly are not. There have been several polls over the last few months that have shown this increased opposition. However, there have been a few polls in the last month that have seen a slight reduction in the opposition. So in other words, people seem to have resign themselves to the Olympics. But there's still a lot of opposition. You have a lot of public figures, even some of the main newspapers of the country that have come out with their op-eds calling for the cancellation of the Olympics. But at this point, it's too late. The Olympics are starting in just a couple weeks. A cancellation would cost billions of dollars to the Japanese government, because according to the contracts that have been signed, it is only the International Olympic Committee that can decide on a cancellation. So they are not going to be canceled. It would be a disaster. I think, too, we cannot discount national pride. I think for Japan, it's a matter of pride, too, to hold these Olympics. They don't want to be a country that will be forever associated with the canceled Olympics. So, yeah, in the end, I'd say the Prime Minister Suga, his political survival really depends on how well these games go.
So, Megan, if you want to give any advice to the Tokyo organizers, what would it be? Because we have already heard some news, some athletes from some countries tested positive for the coronavirus, and anything can happen during the summertime. What would you advise them to do?
So I actually wrote a piece back in February suggesting that the Olympics be postponed again because the rates of vaccination in Japan are so low, and of course across the world our vaccination rates are still so low. But given that the Olympics are ongoing, that as Benoit just described, they're not going to be canceled. Folks that come into Japan for the Olympics need to quarantine and need to test out of quarantine. So not just getting out of quarantine because you've been asymptomatic, but to actually test out. That maintaining of the bubble for the athletes is critically important. And if I were in charge of the Olympics, if they were going on, I don't know that I would allow international spectators. You know, it goes against the whole spirit of the Olympics to not have spectators. It would be disappointing for the athletes, as well as for the folks that have spent a lot of money to try to go and cheer on their home country. But from a safety perspective, those spectators mixing from countries across the world, many of whom are not vaccinated, is not a great idea.
Okay.
The last thing is that in an ideal world, you would have everyone who's attending the Olympics, both athletes and spectators and staff, fully vaccinated. But that too, it's too late. The Olympics are only a few weeks away, and it takes at least 4 weeks to reach full vaccination.
So, Benoit, are the Japanese authorities prepared for the worst? For example, if there was a super spreader event or there was a high infection cases during the Olympic Games, God forbid, are they prepared for that?
I think they are prepared, and they are very worried about that. And not only the public has shown through surveys as well that they are worried about a surge in coronavirus cases after the Olympics, but the top medical experts in Japan just came out a few days ago and have warned of this possibility. I think they have done and will do everything in their power to limit that. I've already mentioned some of the measures that have been taken so far, including adding a lot of health and medical professionals at the sites of the Olympic. But given the thousands of people, and just talking about the athletes here, given the thousands of people that will be there, it will be hard to avoid any kind of surge during the next few weeks, and that's going to put even more pressure on the country, on the health system, and on the economy, quite frankly.
All right. Thank you very much, Benoit, and thank you, Megan, for your analysis and insights. And you've been watching Dialogue here on CGTN. I'm Joe in Beijing. Thanks so much for watching. Goodbye.